Hello, everyone. My name is Chizoba. My presentation is on obsessive compulsive disorder in children and adolescents. So, understanding OCD. OCD is a chronic mental health disorder characterized by intrusive thoughts and repetitive behaviors. These behaviors are usually performed to reduce anxiety or to prevent a feared outcome, even if that outcome is not realistic. In children, OCD often begins between late childhood and adolescence, and it affects about 1 to 3% of young people. OCD can interfere with school performance, daily routines, and relationships. Research has shown that OCD develops through a combination of genetic factors, altered brain chemistry, and environmental stressor. So let's look at how OCD presents in children. OCD can have different presentations in children as compared to that of adults. Obsessions can include fear of contamination, fear of harming others, or the need to do things the right way. Compulsions may be excessive hand washing or checking things repeatedly. For instance, a 10-year-old might wash his or her hands repeatedly after touching a pencil, and a teenager may check the bedroom door multiple times before sleeping. So, this is how OCD presents in children. Children also have poor insights and may be unaware that their thoughts are irrational. And comorbidities are also common in this population. OCD may present with ADHD, anxiety disorders, or tech disorders in kids. So let's look at brain regions involved in OCD. In OCD, the orbitofrontal cortex is hyperactive, leading to unwanted, repetitive thoughts and overconsciousness. Then the anterior cingulate cortex, or ACC, helps detect errors in OCD. And the caudate nucleus fails to filter out unnecessary thoughts, which leads to compulsive behavior. And the thalamus then keeps sending this signal back to the cortex. And finally, the amygdala heightens the fear and threat response that fuels anxiety and the need to perform compulsions. So, together, the orbitofrontal cortex, the anterior cingulate cortex, the caudate nucleus, thalamus, and the amygdala are areas of the brain that drive the constant cycle of obsession and rituals that we see in OCD. So let's look at the neurotransmitters involved in OCD. Number one is serotonin. Number two, dopamine. Number three, glutamate. And number four, GABA. Serotonin is the primary neurotransmitter of OCD, and low serotonin activity contributes to obsessions and compulsions. This is why we use SSRIs as the first line of treatment in OCD. Number two is dopamine. Dopamine is also involved because dopamine contributes to habitual repetitive behaviors. Then number three is the glutamate. The glutamate is likely excessive. Then the excessiveness overstimulates the activity between the brain regions. And GABA is number four. The GABA activity is decreased in OCD. When the GABA activity is decreased, the brain's ability slows down or relax. And these are what we see in OCD. Then the next one is the brain pathway involved in OCD. The primary brain pathway involved in OCD is the CSTC circuit. The brain gets stuck when this circuit becomes overactive, resulting in repeated intrusive thoughts and the need to act on it. Then the prefrontal cortex, normally in charge of stopping unnecessary signal, has a hard time regulating the loop. In children, the imbalance can be prominent because their self-control system are still developing. Also, brain imaging studies like the functional MRI have shown that successful treatment with either SSRIs or CBT normalizes activity within this circuit, within the CSTC circuit. So let's look at the treatment of OCD. The best treatment for OCD is a combination of both medication and therapy. CBT is very important, especially the exposure and response prevention. Then the SSRIs are the first line medication for OCD. Medications like fluoxetine, sertraline, and fluvoxamine are approved by the FDA for OCD. These medications help to rebalance the serotonin system. In severe cases or where we have treatment-resistant cases, low-dose atypical antipsychotic like Risperdal can be added. Together, medication and therapy promotes neuroplasticity and rebalance the CSTC circuits, which improves brain function and overall quality of life in children and adolescents with OCD.